Well, today we're delving into bladder ulceration, also known as Hunner's ulcer in the context of interstitial cystitis. This condition involves the formation of open sores or ulcers on the inner lining of the bladder. While relatively rare, it can cause significant discomfort and impact quality of life. We'll explore the causes, symptoms, diagnosis, and management of this challenging condition. The exact cause of bladder ulceration is often unknown, especially when associated with interstitial cystitis. However, several factors are believed to contribute. These include chronic inflammation of the bladder wall, autoimmune disorders where the body's immune system attacks bladder tissue, genetic predisposition making some individuals more susceptible, and potential associations with infections or previous bladder trauma. Further research is needed to fully understand the underlying mechanisms. The pathophysiology of bladder ulceration involves a complex interplay of cellular and inflammatory processes. Chronic inflammation damages the glycosaminoglycan, or GI, layer which normally protects the bladder lining from irritating substances in urine. This damage exposes the underlying tissues, leading to increased permeability, mast cell activation, and further inflammation. Over time, this chronic inflammatory process erodes the bladder lining, resulting in the formation of ulcers. These ulcers can then cause bleeding and urgency. Bladder ulceration, particularly Hunner's ulcers associated with interstitial cystitis, is considered a relatively rare condition. Interstitial cystitis itself is estimated to between 3 to 8 million women and 1 to 4 million men in the United States. Hunner's ulcers are only present in a small percentage, approximately 5 to 10% of interstitial cystitis cases. It's more commonly diagnosed in women between the ages of 30 and 50, but it can occur in men and individuals of any age. The symptoms of bladder ulceration can vary in severity, but commonly include persistent pelvic pain, often described as pressure aching or burning. Urinary urgency, the frequent and compelling need to urinate, is another hallmark symptom. Patients also experience urinary frequency, needing to urinate many times throughout the day and night. Pain may worsen with bladder filling and be temporarily relieved by urination. Hematuria, or blood in the urine, can also occur. It's important to note that these symptoms can significantly interfere with daily activities and sleep. Diagnosing bladder ulceration typically involves a comprehensive evaluation. This includes a detailed medical history and physical examination. Urinalysis is performed to check for infection or blood. Cystoscopy, a procedure where a thin tube with a camera is inserted into the bladder, allows direct visualization of the bladder lining and identification of ulcers. A biopsy, taking a small tissue sample, may be performed during cystoscopy to rule out other conditions like bladder cancer and confirm the presence of ulceration and inflammation. Bladder capacity tests and potassium sensitivity tests can also be helpful in assessing bladder function and sensitivity. While the primary form of bladder ulceration we've discussed is often associated with interstitial cystitis and referred to as Hunner's ulcers, it's important to acknowledge that ulcers can also arise from other causes. These could be broadly categorized as ulcers secondary to infection, medication, or trauma. However, in the context of IC, Hunner's ulcers are considered a distinct subtype characterized by the presence of chronic inflammation and distinct histological features. Treatment for bladder ulceration is multifaceted and aims to alleviate symptoms and promote healing. Conservative measures include dietary modifications to avoid bladder irritants like caffeine and acidic foods. Pain management strategies such as oral analgesics and pelvic floor physical therapy are often employed. Bladder installations, where medications are directly instilled into the bladder, can help to soothe and protect the bladder lining. For Hunner's ulcers, fulguration or laser therapy during cystoscopy can be used to cauterize or remove the ulcers. In severe cases, surgery such as partial cystectomy or bladder removal may be considered as a last resort. Unfortunately, there's no definitive way to prevent bladder ulceration, especially when it's associated with interstitial cystitis, as the underlying cause is often unknown. However, adopting a bladder-friendly diet, managing stress, and promptly addressing any urinary infections may help to minimize bladder irritation and potentially reduce the risk. For individuals diagnosed with interstitial cystitis, adherence to their treatment plan and regular follow-up with their healthcare provider are crucial for managing the condition and preventing further complications. The prognosis for bladder ulceration varies depending on the underlying cause and the severity of the condition. While a complete cure may not always be possible, many individuals can achieve significant symptom relief and improved quality of life with appropriate treatment. Recent research is focused on identifying specific biomarkers for interstitial cystitis and bladder ulceration to improve diagnostic accuracy. Novel therapies, such as regenerative medicine approaches to repair the damaged bladder lining, are also being investigated. Continued research is crucial for developing more effective and targeted treatments for this challenging condition. Remember to consult with your healthcare provider for personalized advice and management.